September is recognized as Suicide Prevention Month. Our next guest we're putting in the spotlight is a champion of mental health advocacy. In 2018, Mike Shoreman was diagnosed with Ramsay-Hunt syndrome. He overcame his own struggles with mental health and suicide and became the first person with disabilities to cross all 5 Great Lakes on a paddleboard. Well, he now travels across North America promoting mental health awareness. Mike's most recent work has been with the Sandy Lake First Nation in Northern Ontario. That is where he joins me from now. Mike, it is great to see you. Thank you so much for this.
Thank you for having me, Angie.
This is an issue that is so important and close to you, but it's an issue that is still very, very difficult to talk about. And when we look at the stats, Statistics Canada, we know, is reporting that suicide rates among First Nations people 3 times higher than the rate among non-Indigenous people. Talk to me about some of the conversations that you're having, the work that you're going to be doing there, that you are doing with Sandy First Lake Nation.
Yeah, thank you. So, first of all, it's a huge honor to be able to be invited into this community and to be a part of their program. So their program is the Choose Life program. The Sandy Lake First Nation community with a population of about 4,800 people. It's a fly-in community, so it's very remote along the Manitoba-Ontario border, and you know, suicide rates are significantly higher in Indigenous communities. And just for example, we scheduled this event probably about 8 weeks ago, and there have been 3 in that time. And I spoke with the event coordinator last night, and he shared with me that over the past 5 years there have been 20 in this community alone. So it is, you know, a topic, you know, it's a thing that's significantly impacting this community. So I'm thrilled to be here, participating in a number of workshops, keynote presentations, and community activities. Last night we did a walk for World Suicide Prevention Day, and it was very special to be a part of that.
Yeah, indeed, and I think you being there, showing your support, but I mean, 20 beautiful lives lost. It's beyond devastating, but this also is very close to home with regards to your own story. You were once in that unfortunate mindset. Talk to us about what your journey has been like. I know you went through a great deal of depression. You were at a point where you wanted to take your own life. Can you give us a little more insight into that as you feel most comfortable, Mike?
Absolutely. In 2018, I acquired a series of disabilities all of a sudden with my neurological condition, and there was significant life change, and I didn't have the coping tools or the strategies to deal with that at the time, and my depression worsened, and I cut off from family and friends, and I became very isolated and very I felt very alone. And so being here, you know, in this community, we've spoken about the you know, the feeling of being separated and feeling alone, in, you know, disconnected from you know, what's outside of this community, and even with others within it. And it's just, you know, been an amazing opportunity to connect with other people who have been through, you know, suicide ideation or attempts, or those who have lost someone, and those who are struggling, and talking about resilience strategies and coping mechanisms and tools that can be used as a method to prevent suicide.
How has it, you've always talked about communication, and you said it right there, being open, trying to be as direct as you possibly can, even when if it's such a difficult issue, a very personal issue. How has, what kind of feedback so far have you gotten in terms of how perhaps it's helped some of those community members? But I know this also helps you in your journey.
No, speaking about mental health, for me, allows me to breathe. So I'm invited into a workplace or into an organization or into a school, or in this case, into a community. It gives me life. It gives me purpose. A common theme with mental health is the loss of purpose and the loss of connection. And I feel like when I'm communicating or when I'm speaking with people and having dialogue with others, breaking down stigma through open conversation, it empowers them and it fills my cup up too. But just listening to some of the crises that are facing people here at the Sandy Lake First Nation, domestic violence, mental health from residential schools, that is still being felt today. The impacts of that, substance abuse. I learned yesterday that they feel very lucky that methamphetamine hasn't crossed into this community, although it's prevalent in others. But they do deal with substance abuse, cocaine, heroin, opiates. So to have these conversations and do these workshops and do these activities is incredible. The other night they had a family night, which was incredible. They invited families from all over the community and had games to promote substance-free evenings of fun. It was so impactful and a lot of fun for kids and families, and really an interesting thing for me to observe.
Yeah, no, absolutely. And a beautiful thing that you're doing with a community that's got so much promise there, that needs a lot of that support, and having you be part of that support for them, I know is incredible. Mike, really appreciate you doing this, and we're wishing you well and the work that you're doing there for the community, and of course the community members indeed. Mike Shoreman, a mental health advocate, joining us from the Sandy Lake First Nation in Northern Ontario. Mike, thank you again for this.
Thank you again for having me.